The number of babies born dependent on drugs continues to rise in our state. This is a topic our investigations team has examined in the past, and now a southeastern Kentucky hospital is giving a drug to pregnant mothers to treat the drug addiction. WKYT's Miranda Combs has the story.
Outside of this building, life can be a struggle.
The drug problem has always been an issue here in Clay County.
But this small room can be a fresh start. About 200 babies a year lay down on these blankets. They are monitored and comforted, but there's a percentage in here that hurts.
It is heart-wrenching because they are innocent. They can't do anything about it. I mean, the mom's making decisions for the baby.
And about 30% of the babies born here are born dependent on drugs.
Yeah, they've made that choice, but especially in this area, you know, that's kind of the normal. That's how they're brought up sometimes.
Christina Birchfield has been a delivery nurse at Manchester Memorial for 4 years. Recently, they've made some changes. Instead of just seeing what comes through the door, they are catching moms before the birth and putting them on the treatment drug Subutex, which is similar to Suboxone but used for pregnant women.
I would say since we've started the Subutex program, we've seen about the same number of substance abuse mothers, but we've seen a lot less withdrawal symptoms in the babies.
They say moms that follow their program of twice-a-week checks and constant monitoring along with the Subutex are usually able to keep their babies here. Birchfield says when she started here, 25% of the babies delivered were transferred out at birth because the withdrawal symptoms of the babies were too much for the small nursery to handle. And this is where they typically have to come, Kentucky Children's Hospital's neonatal ICU, where at any given time as many as 20% of the babies in here are withdrawing from drugs.
Because these babies are needing treatment. So some of them will stay 30 days, some of them will stay 2 weeks, and some of them may stay 2 months or even longer, depending on whether we can capture their symptoms or not.
Dr. Henrietta Bada has been tracking the rise in babies born dependent for years.
You're frustrated.
Well, I am, because we keep on seeing these babies and they're helpless. And we are the ones that should be taking care of them.
The numbers statewide of neonatal abstinence syndrome, or babies born dependent on drugs, continue to rise. In the year 2000, there were 29 babies in the state born with NAS. Jumped to 2013, Bada says there were 1,000. In 2014, there were 1,400.
I think if we can address the mother's issue, then we as pediatricians taking care of the baby would be able to help address the baby's issue.
Bada says babies do still withdraw from Subutex, the treatment drug being used back in Manchester. But Birchfield says the symptoms they see from Subutex babies are less severe and they can handle them here. That 25% transfer rate has dropped to 8% since they started the Subutex program.
We've seen a lot of improvement with those babies and the care that we're able to provide them.
Because the main goal, they say, is to keep the baby home and keep mom on a steady path to sobriety.
All of these moms want to do what's best for their babies, but the drugs have such control over their bodies that, you know, mentally and physically, they're not able to stop.
At Manchester Memorial, mothers stay in the Subutex program for at least 6 weeks after delivery. Both that hospital and Dr. Bada at UK say there aren't enough resources for mothers struggling with addiction after birth. Dr. Bada told us Subutex is a supplement to mental health and addiction programs, but shouldn't be a mainstay for these mothers.
Those numbers are really tragic. When you talk about Subutex in the hospital, they feel like it's also a help in terms of the mom and their mental well-being?
Right, because think about it. These mothers are getting introduced to a doctor. They're getting that prenatal care that a lot of times they weren't getting before. So it's a win-win in that respect.
All right, Miranda, thank you.